off in a small town of northern Ontario, Canada, where his parents divorced when he was 6. His early theme in life was, "Let me be the one to take the pressure." As he was the goalie in hockey, the pitcher in baseball, and the head chef at the busiest restaurant, he loved to inspire his team for their best performances and took pride in group excellence and growth together. Further along, he attended chiropractic school and furthered his training in somatic breathwork practices, consciousness studies, cognitive remapping, family dynamics, and looks to put these disciplines into systems so people can achieve the next level of their health, well-being, and life. Ultimately, his early theme has stayed the same: how to lead and inspire those around him so they can value themselves and go after what they want to achieve in their life. And I certainly felt inspired. So welcome, Stephen.
Well, thank you very much. When you had invited me, I was so grateful to actually have an opportunity to be positioned with a group of like-minded individuals. So thank you very much. And part of me, there's a part of me that feels risky to attempt to repeat the same river that we had originally stepped in. So I do have to, in part, let that piece go. I'm just going to deliver what I can deliver in this time period, and hopefully there'll be some value there for everyone.
Perfect. Thank you.
Yeah. Because I was thinking, how do I repeat what I did? And I think I'm preaching to the choir when we're like, well, that's like quite a hard task to attempt to repeat what you did again. So part of our journey of letting go and just allowing intuition and innate to inform and educate, and I'll try to give you as many kind of inroads to my world as possible, and hopefully there's something new that emerges and we learn. And I appreciate being at this group. I think, to me, to start out, I both love education, but at the same time, I equally love experience. And hopefully you line up with some of that in terms of learning through the actual experience. So what I'd love for us to do is just to take 3 minutes just to start and just begin to do some somatic breath work, timed breath work, because I'd like to provide you with an opportunity for you to experience the different gears available in the brain, and the different gears available through the brainwave states. And it'll be short-lived, but it'll be some tangible experience of how the brain can shift its gears, and then I can go into different ways in which it can benefit you and which you can utilize them. So if you're okay with that, I'll guide you through this very, very simple little breathwork sequence. And the idea would be is you don't need to be watching me. The idea would be just to close your eyes so that we can tune out the external world, and provide the system with some energetic awareness on the internal domain. So if you're okay closing your eyes, I would definitely invite you to do that. And we'll just go through a simple little breathwork series. So we'll begin just, your hands can be in your lap, feet are rested nicely on the ground if possible, and our eyes are going to be closed. The breath will be in the nose and out the mouth. In the nose and out the mouth is a peaceful baseline grounding breath. In the nose and out the mouth. And just noticing just your natural tempo of what feels right for you in the moment. Bringing some conscious awareness to what you're doing, but not necessarily trying to control anything in this moment. And you can breathe into your belly, you can breathe into your chest. The idea will be is it's going to be promoting a relaxation breathing nonetheless. So any area of your body that you'd like to breathe into is absolutely fine. I want to invite you to begin to pace your breathing, meaning if you can count 3 seconds in the nose and 3 seconds out the mouth, I want to encourage you to see what this pace does for your brain, your thoughts, the feeling in your body. 3 seconds in and 3 seconds out. Oftentimes, if you've done some personal development work and consciousness work, this is going to feel a little rapid. But just kind of get a sense for this gear. Perfect. Now, we're going to ramp that up a little bit. And I want to encourage you to breathe 5 seconds in and 5 seconds out. This will promote beta brainwave activity. And it's an alert activity of brainwaves. Allows us to function in the world. So in your mind, just pace 5 seconds in and then 5 seconds out. Beta brainwaves allow us to be active, allow us to be aware of our external environment. They allow us to set up modes of protection and boundaries. They're also the brainwaves that allow us to execute tasks and part of our performance, so to speak. Next, I want to invite you into the realm of alpha brainwaves, which begins at 7 seconds in, 7 seconds out. And it's going to promote it. So it's like your brain and nervous system promote the expression of these waves 7 seconds in and then 7 seconds out the mouth. In the nose, out the mouth. 7 in, 7 out. So just note your level of presence, the level of control required. And alpha waves are our classic movement towards a meditative state. Beautiful. Good. And just stay with that for just another few seconds. Good. And then on the next breath, I want to invite you to pursue the idea of 9 seconds in and 9 seconds out. That's going to gently promote theta brainwaves, more of the hypnotic waves, the deeper growth and repair waves when we head into sleep. It's a transition between going to bed and falling asleep and then going into deep sleep delta. It's a transition point, really important in terms of falling asleep, and it's also important in the growth and repair of our organism. So 9 seconds in and 9 seconds out. Just watch your level of presence to embark on that little journey. In my assessment of over 200 brainwave patterns now in my practice, this one is definitely the most deficient in terms of its expression for people. 9 seconds in, 9 seconds out. In the nose, out the mouth. And the last one I want to invite you towards is the striving towards delta. Delta brainwaves, 11 seconds in and 11 seconds out. Just see if you could prolong the breath another 2 seconds on that inhale in the nose and then the exhale out the mouth. 11 seconds in and then 11 seconds out. And really get a taste for the level of awareness and presence that's required to pull this off. If you can't do 11, just stick with 9. If you can't do 9, then do 7. Beautiful. And just relax. You can slowly open your eyes. Was everyone able to feel a little bit of the gear changes that were required as we're kind of like changing some of the breath sequences? Did you notice that? Trained as a chiropractor, which I'm grateful for, the major premises when I went to school, and really what I loved about chiropractic was really its philosophy on healing. It allowed me to get a philosophical basis on healing. And it trained 21 years ago. You know, the body's self-healing and self-regulating. And I think that most of us in this circle would agree to that. You know, we're not thinking about our heart beating necessarily, our food digesting, or our kidneys filtering. That's a self-regulatory process. The innate intelligence of the system takes that over, doing 30 trillion bits of information per second. We need to delegate. So we are master delegators to the unconscious and allowing that system to process in a self-regulatory way. And also from a self-healing, I mean, if we cut ourselves, we know that the immune system's going to come in and clot and do its thing. So we're self-healers and self-regulators by nature. And at the same time, raised in the chiropractic landscape that I was at the beginning, it really was about adaptability of the nervous system. And we looked at dis-ease as a lack of adaptability of the central nervous system and the brain to meet the demands of the environment. And when I've worked with 140,000 clients over the 20 years, at least there's been some evidence, whether I was biased to see it or not, there seemed to be evidence that this was really important, that the nervous system was able to be adaptable, meaning if the environment required you to step up in your energy and to perform, the nervous system needed to be able to shift that gear to be able to perform and do it. But also, for people that were hanging out in the dis-ease state, when they went home after work, let's say, and their ability to gear down from that, instead of staying in more of a sympathetic or fight or flight mode, that became problematic. So D.D. Palmer, which was a founder of chiropractic in 1895, apparently got a nice download from some seance. He used to be a magnetic healer, some seance. But the quote that I enjoy from him was that tone is the expression of life. Tone is the expression of life. And so what I wanted to bring you through there was, 1, 2, 3, 4, 5 different tones of an expression of life that are available to us in terms of able to shift gears. And I think of them almost like guitar strings on a guitar, where the 3-second in, 3-second out is more of a pingy sound, the higher pitch, a higher sympathetic fight or flight frequency. Then you start getting down to a slower vibrational sense of theta, which is wow, and you get into that lower theta state or even delta state, which is a slower wave process through the system experientially. And so our system has these different tones and these different string plucks. And for me, when I'm working with clients, my kind of clinical desire for them is to be able to play out any string that life is requiring of them to play out. Except depending on their upbringing and traumas and circumstances and what they've been through and current life situations and circumstances, generally they're habituated to playing out 1, 2, maybe 3 strings at most. Most of the people that are coming in are highly strung on the high sympathetic side, or they've played that side out so much that their systems become exhausted and looking to check out on the delta and theta side and moving them more into just lethargic behaviors and depressive behaviors and sadness type of behaviors because their system just can't uphold the energy required from that certain expression, that certain tone. So in my practice over 20 years, I've been on a bit of a quest to help people to maneuver and adapt their way through, making sure that they could meet not only their internal desires, but also what is the environment requiring of them at the same time. And so I started off on a very kind of physical basis. And then, we learned long enough and we realized, wow, there's some emotional components to this system of a human being. And then, wow, like there's psychological components that are influencing these guitar strings and adaptability. And wow, there's seemingly spiritual elements to this being. And so I just cascaded myself up over the years, just trying to include more and more pieces of ourselves into my protocol when I'm working with clients, and just my overall awareness of what's influencing the tone and the expression of their life. And I feel like they all have equal weight and equal value. For the people that have gotten really headsy, I like getting them in their body. The people that are expressing more density and in their body, I like to question them about, what are you after in life? What do you think's calling to you to kind of move towards? So getting pieces and integrating pieces for me is an important aspect of the practice. But central nervous system being a primary focus for me in terms of self-healing and self-regulating. So at the risk of repeating some things that you already know, I'll try to just start from the root and kind of work my way up as to what I've noticed in practice over the last number of years, and hopefully some of that is going to be interesting to you. I just worked with a woman. She was 74 years old. Her name was Linda. She's still around. She came into me and we first assessed the brainwave function and brain function. She had very little theta brainwaves, and she had these beta brainwaves, which are our active brainwaves, which after 20 minutes of testing really tailored off. So she couldn't really hold her attention very well. And during the testing, these alpha waves, which are conscious relaxation waves, they were rising during the test. And so she had this conscious falling away of her ability to stay with the testing. And it was like her system was checking out during the testing. When we look at that, we look at old trauma, concussions, we look at kind of early dementia type of stuff that's being kind of predicated in the brain. And when I was consulting with her, she had a lot of brain fog. She couldn't really get out of bed in the morning. She was just not feeling very inspired and very motivated. Her daughter had just not committed suicide, but basically due to drugs had just passed away. She was like in her mid-30s. So this woman was definitely challenged. She had a lot of relationship issues with her father, and this woman's 74 years old and still deeply bothered by that. She was doing internal family systems therapy when I first saw her. So she had definitely a lot that was going on. And when I was reading the nervous system and looking at it, this woman was looking to check out. It was exhausted. She couldn't kind of hold her energy and hold that 3 second in, 3 second out energy, or 5 in, 5 out energy. She couldn't hold that through 20 minutes. It was already checking out and deviating into other realms. So there's a few things I wanted to mention about this particular case that I think you might find interesting that I wanted to share with you. The first thing that we did with her was we actually went through and helped her to recapture why life is important to her. Because if she's not seeing why the environment is important, why she wants to participate in life, then that's required by beta brainwaves to do that. So when she was low on the beta and starting to check out, we added and we looked to add value. Why is it valuable to be alive to you? And so we went through almost 100 reasons for her to actually be alive. Everything from going out to camp, enjoying the splashing of river water, feeling the sun, planting her flowers, feeling her hands in the soil. I mean, we went into detail because when you look at the brain and neuroplastically, we want to help to reform and reshape and create new patterns in the brain. And so we go into details away from generalizations and more into detail to get some neuroplastic changes happening in the brain. And we went through about 100 examples, close to 100 examples of reasons that she has to be alive. And the surge of energy that started to come about was incredible. She had been very lethargic and kind of parasympathetic, one half driven on her nervous system. And this spike of, I would say, adrenaline for life began to change the brainwave patterning and change literally her facial expressions of how she wanted to participate in life. So that was the first thing that I covered with this woman that was severe brain fog, traumatized by her daughter's recent passing, really tormented through past issues with her dad. This is the pathway that I started to pursue with her, is let's just find some value in life first so that we can appreciate you relative to life and what life has to offer. That seemed to uptick the brain wave energy. The second thing is she felt horribly guilty about, and she felt like a failure as a mother. And that was creating depressive brainwave patterns that would initiate more alpha, more checkout type of pattern waves. So the second exercise that I brought her through was her value as a mother. And so we went through about 75 ways in which she actually succeeded as a mother. And she was in tears at the end in terms of appreciation for herself, that she actually did the best that she could. And I think that that's probably reminiscent of many of our personal development or spiritual work that we do, is this loop around towards love and appreciation again, creating a stillness in our awareness, that essentially nothing's missing. And so when we go through this exercise and we found about 75 ways in which she was successful and valuable as a mother, the guilt you could just see lifting, that she really did come to her own inner conclusions, that she did the best that she could. She couldn't do any more. She taught them all this art. She did some homeschooling with them. She brought them through some, I'm trying to think of the religion that she was raised in. I can't remember, it's not coming to mind right now, but just infusion of values, infusion of her philosophical views, infusion of her homeopathy with her kids. So we went through and saw all the ways that she just adds so much value to them. And so again, another uptick of value, another uptick of beta brainwaves to get her re-engaged with life. As we do that, we're uplifting some of the sadness that comes with some of these alpha theta waves, and upticking that energy. So the first part for me with this brain fog situation was to get this fight or flight, this sympathetic, this higher cortical function on board so that she could be on board with life again. And that seemed to be really helpful to really catalyze her energy to get her moving again. We need the sympathetic, the fight or flight. We need that system to be able to move and execute in life. And if we're not seeing the value in life itself, or we're not seeing our value in participating with life, and what our value actually is, then we are going to be sluggish and resistant and procrastinate in terms of movement forward. Once I've done this work with people for well over a decade in terms of values work. And it's incredible. I do it each week on myself to make sure that I'm staying updated with my current level of value, and also how's the world valuable to me, so I can stay in that synchronous loop and the fair exchange between me and the world around me. And I find this to be very fruitful in terms of an exercise to detail out my value and the world around me, its value back to me, and feeling that fair exchange between the two. So I implemented those for her to activate her nervous system, activate the higher centers of her brain, and uplift energy that was sagging down due to just broad generalities like, I suck as a mom, I'm horrible, I feel horrible, and what's the point of going on? These generalities are a wash of emotion that don't actually, that keep us in our subcortical, or subcortical is the best word, strategies of the nervous system. And so the idea is we want to get this right and left hemispheres of the brain back on board, higher cortical centers on board again, for all of us to stay really refined and in tune authentically with what we're creating, what we're generating, and what we're pursuing. So those were the first couple things that I covered with her, which seemed to really uptick her energy. And even after when we redid the brainwave scans, after those two exercises, her beta brainwaves were up. They were staying on board for the whole testing, which showed me that there was more reserve cortical energy in there to be able to basically manage herself relative to life, which was really important at the time. So that's kind of, hopefully that's not too much, but this is kind of where I wanted to introduce you to some of the brainwaves and how this works. Now, the next part I found really fascinating, and hopefully you'll find it as fascinating as I did. When I looked at as I mentioned in my bio, my parents divorced when I was 6. And I think it gave me a really natural curiosity for studying the nuclear family and family dynamics. And I'm sure part of it was like, why the hell did my parents break up? And trying to understand human behavior, understanding the nervous system, and then understanding deeper about family dynamics. That has been part of my path. I had a book published by Penguin Random House called Finding Magic in the Mess. It was for younger parents. I was a younger parent at the time. Just about kind of like the art of letting go and just allowing more things to being more emotionally stable in the family dynamic. But I think part of that early divorce was definitely a catalyst, an early wound, I guess you could say, that had me a bit on a pursuit of family dynamics and part of the creation of a solid family matrix within myself. So, but what's really fascinating, she was studying internal family systems. And when we went through and we started to look at what was the value to her dad, because I know that there was a lot of resentment around her dad, which if there's resentment, there's a real kind of mix up with brainwave patterns, especially with a lot of resentment. And so we went in and the one thing that we started to study was I asked her a couple questions of what parts about your dad did you despise or dislike the most? And she went through and rhymed off about 10 or 11 things that she disliked and despised the most about her dad. She was trying to forgive him, essentially. And so she was on this path of trying to forgive. And so a really interesting piece was as we went through all the pieces that she disliked about her dad, I asked her, what was the opposite of those parts that she disliked. And so, for example, she said that, he wasn't around physically, because he worked out of town. And I'm like, okay, so I said, well, what was the opposite of that? Well, being safe, being the opposite of that was being safe and supportive physically. I'm like, okay, what else did you not like about it? So we went through again a handful of these things that she disliked, and each time I had her flip to the opposite. And when we looked at the opposite, so she was physically safe and supportive. The opposite of betrayal was trusting. The opposite of like not being having integrity with her word, being dishonest, was honest. So she had like this list of things that were the opposite. And so when she looked at that, she's like, oh my goodness. She said, those are all the qualities that I look to infuse in my kids and my grandkids. And I said, well, isn't that fascinating? That the things that you dislike the most, how they shaped your values, and then how your system naturally went to execute those, and that the very voids that your dad created actually birthed and shaped who you were as a person, and had you go and behave a certain way. And I thought that was really, really incredible for a couple reasons. One is it gave me a very interesting view on family dynamics and the role of the nuclear family shaping behavior and shaping values. And also, it was undeniable to her at that moment in time that her dad was in part responsible for all the things that she really valued about herself and valued to bring to her family. And so in that moment, she had a tear of gratitude for her dad for helping to shape the things that were really valuable about her. And I thought, Mom, like, that's really fascinating that she's seeing this interweave between the parts of her dad that she didn't like and how they birthed parts of her that she really admired and valued and looked to bring for over 40 years into her most intimate relationships. And so that merging for her was transformational. And it gave me really great insights into the family dynamics. And so I inquired more and more about this. And so what I did find, I'll just share this with you, and I don't have diagrams to provide with you, but hopefully you kind of catch what I'm saying, is when I looked at people, and I've started to do this, when I've looked at the mom and the dad as the beginning points, and we chalk out what you like and what you don't like about each parent. What you like about each parent promotes the parasympathetic supportive pathways, and what you don't like about the parent promotes the sympathetic fight or flight pathways. And the parts that we admire about our parents, we carry on as tradition. And we lock in that that's supportive. And it also creates expectations that that's how other people are supposed to support us in our life. And so it's like this tradition that we carry on of parts that we like and admire about our parents. We carry that forward and create expectations about what support means in other relationships. And on the flip, the parts that we don't like about a parent, we flip to the opposite and we value the opposite. And we actually resent the parts that we dislike, and those create triggers. So it outlines for me how we carry out tradition through the parts that we admire in a parent, how we interpret support by other people through those admired parts, whether it's the mother or father. And then also describes the triggers that are established early on by the parts we don't like. And those triggered parts we don't like, when you flip them to the opposite, they're what we admire within ourselves and value and try to craft out as new in our life. And so we have this blend of a persona that is both a carrier of tradition from parts that we like, but then we birth the opposite within ourselves. And those are what creates authenticity and newness and evolutionary patterns moving forward. So when I become authentic, I'm carrying the tradition of what I liked, and I birthed new expressions as part of this evolutionary leap from my parents. And so we synergize as parents, they birth me, and then I take the parts I like from both and I carry those on as tradition. And then I flip the opposite of what I didn't like and tell myself, I'm never going to do those. And I'm going to do the opposite. And I carry those. And now I've created a new authentic kind of personality structure, persona. And these things, when they're not necessarily ironed out well, they really change the brainwave patterning. So I wanted just to kind of lay that out as a bit of a foundational idea for people that are consciously aware, and love your feedback on it. But that's what I've seen patterned so far when I've delved deeper into the family dynamics. And it's a bit of a build off of Dr. Murray Bowen's work of the interlace of family dynamics. So if anyone's interested in family dynamics, I'd love to have a conversation about that.
Excuse me, Doctor, you have until 8:50 if you want to budget your time, and also if you want to open for questions and answers.
Perfect. Yeah. So this, I'll close just perfectly here. The idea within the central nervous system, the brain and the central nervous system is, at least in the brain, is to organize the brain waves. Resentment, guilt, and shame alter brainwave patterning. Resentment spikes up beta brainwaves and gets them too aggressive. And guilt and shame push the system towards more of a parasympathetic alpha brainwave state. And the resolution of guilt and shame and resentment I see as paramount to reorganizing our brain and creating neuroplastic brainwave patterns so that we have not entropy and breakdown, but we have a constant reformation and buildup of the brain. And when you clear the resentment, the guilt, and the shame, and you organize our life into meaning and value, it appears as though there is a gamma burst wave that reorganizes all brain waves. And it ignites the heart rhythms and increases heart coherence and brainwave patterning in terms of their level of organization. So in our pursuit, I see as questing spiritually is not only to let go of pieces that no longer serve us, but also to organize our brain and our perception of our reality into wholeness, into oneness, into a nothing's missing, into a value, and into meaning. And when we do that, we seem to optimize brain structures and optimize our autonomic nervous system. And we can do that through organizing family dynamics, and we can do that organizing our environment and reminding ourselves of our value with the world around us. So this is a one-day event that I might put on, but I wanted to try to summarize a few things for you, just to give you some things to chew on and to think about. And I'd love to open it up for some questions.
Diana has a question.
Yeah, I really, really loved the way you worked with the woman by having her ask what I call quantum questions, of, well, what is the purpose for living, and allowing our deep inner knowing to come into play. It's the way I live my life. Every day I use a product called Newcom, which you're probably familiar with, that you can choose any brainwave that you want to live in. I use it for 2 hours. And I ask these quantum questions. And I really feel that and with my own father, who was so cruel and so manic depressive and who I loathed, when I look at who he was, I am so like him. I'm an entrepreneur, I'm metaphysical, it's really valuable to take these introspective insights and bring them into the forefront so that we're seeing. I really, really, really got a lot out of what you shared, and I appreciate it.
Beautiful. Thank you for sharing that. Yeah, I love that. Yeah, I'd love to hear more about just the choosing of the brainwaves. That's beautiful. And yeah, it's really rewarding to hear people really pick apart reality and like what they're really enjoying about reality, because it's so, it's like it's so easy to kind of blanket or wash life with, if there's emotional turmoil or things, and for them to really articulate the specifics that really bring them joy is just such a revelation of energy and a reminder for them of what life's really about for them. And so I love that. Thank you for sharing that.
Mm-hmm.
Mm-hmm.
I think Amy was next.
Yeah, thank you so much. May I get, Dr. Steve, what is your last name?
Oh, Fonso. Fonso. Yeah, sorry, I don't know why it's not on my Zoom.
Thank you so much. So I'm a hypnotherapist. And so everything you're speaking is just absolutely so refreshing and new. I think we get a lot of repetitive things in this field, but everything that you're saying is really fresh. I'd like to know how you're getting the brain waves. Are you doing neurofeedback, biofeedback? How are you tracking your brain waves? And I think values are one of the things I've worked with for a long time. There's 442 values that if you actually ask people to go through the list and pick something that just invigorates them, it's transformative, because they actually come so alive with like, yeah, I really resonate with that. I don't know why, but they go deeper, and the reframe is so important. So thank you, and look forward to more information. And are you locally in Los Angeles?
No, I'm way up on the tip of Lake Superior, way up north in Canada. So but I'm always willing to travel. Yeah. So what I measure is there's technology out of Montreal, Canada, called Thought Technology. It's EEG waves, and it's called the stress response evaluation. So we have the EEG leads on, we have all the autonomic hookups, and the stress response evaluation brings them through a cognitive, an emotional, a physical test, and watches how it's responding and how it's recovering after. So we really see neurologically, can they step up to the stress and challenge cognitively, emotionally, and physically through 3 different series of exercises. And then when we pull that stressor away, now what's their brainwaves and autonomic nervous system doing? How is it now down-regulating? Is it dropping into alpha theta like it's supposed to? Is it going into rest, relax, parasympathetic like it's supposed to? Or is it staying fixed and rigid and unadaptable? And so I've used Thought Technology. We got it a couple of years ago. It's been beautiful from informative. Like, I'm not a super huge science guy per se. I try to rationalize things a little bit more, but at the same time, I really appreciate seeing how adaptable a system is and how it's responding to stress. And so we use this technology out of Thought Technology. It's kind of performance recovery technology. So I enjoy that. Thank you for asking. Yeah.
I want to thank you for this is incredible information. Thank you so much. I really appreciate it.
Thank you.
About your breathing, I was wondering which one of the different breathings we tried this morning can I use during the day when I'm low in energy?
Yeah, I would say that the 7 in and 7 out is a really nice way to have the system go from maybe like almost a way of like filling up the gas tank. If you need something quick, that's where maybe a little faster 3-3 is helpful. Like I might use, like in Kundalini yoga, the breath of fire. So you might invoke a breath of fire if you're needing like a quick uptick of energy. But for replenishing relaxed energy, the 7-7 is a great breathwork pattern to use. I'll use that generally midday. Like midday, I kind of teeter on enjoying naps. But if I don't have kind of time for a nap, then I will, I'll do a 7-7 or a 9-9. And those give me like a deeper relaxation and a nice recovery energy about it. Not a feisty energy like a breath of fire, just more of a relaxed refill of energy. So I'll do that for, I looked on the technology, 3 to 5 minutes of that, and your system's into coherence. Like it doesn't take long.
And another question is, I do yoga, and for some reason, when I breathe in 7, I exhale in 9. So that's why when I did 5, I exhale in 7.
Yeah,
Does it have to be exact, or I can let it go as long as it goes?
Well, it can go as long as it goes. I prefer, for me, I prefer symmetry only because the asymmetry is promoting more one side of the autonomic pathway. So if that exhale is longer, the exhale really is the parasympathetic autonomic pathway. So if you're longer on the exhale, you're drawing out more parasympathetic. And all I would just maybe caution against is watch we don't create that as a patterning. I'd like to at least to be able to perform and execute a 7-7 or symmetry. And then, you know, if I want to relax, there's parts that I can't control and I might go longer, but I wouldn't necessarily in my training, I wouldn't promote one side over the other. I try to stay fairly symmetrical just because it's a tough read, whether you're sympathetic dominant, parasympathetic dominant. So I like to kind of be a little more certain that way and try to create symmetry for myself and then let go outside of the training.
Okay, thank you so much.
Yeah, thank you.
Next is Ruth.
Dr. Steve, this has been really fascinating. I'm Ruth Sharon, and I was speaking to a friend of mine yesterday whose son, she believes, has bipolar disorder. And it occurred to me as I was listening to you that this system would be enormously helpful to people who have that particular disorder. And I wonder whether you have gotten involved in any of that aspect, because what I understand from the medication and why so many people who have bipolar disorder don't take their medication is that it turns their highs and lows into gray, and they can't stand that place where everything just seems to be so even keeled. They don't experience life then for them. And so they'll opt out of the medication, even though they're taking chances that they may take their life or that their life is totally unsettled. And it seems to me that this breathing technique, you know, we go to medication for almost everything in our society. It seems like this breathing technique could really help people to self-regulate when they're starting to feel a certain way. So that was
I mean, as Amy was saying, you know, like being able to choose, I think it was Amy, being able to choose the brainwaves and kind of employ selected brainwaves too. Yeah, I mean, would it be really helpful? It seems like it would. I haven't necessarily, for me, attracted a lot of diagnosed bipolar. Part of that being like lithium creates a very rigid autonomic nervous system, and it's a difficult medication. And not that everyone uses lithium, but lithium I've noticed is like it creates such a rigidity in the autonomics. It's really, boy, it's tough to override that med. Like I find it very difficult to override some of the rigidities that creates in the nervous system, both in the EEGs and the autonomic nervous systems. So part of me feels a little bit helpless, I guess, around that, to that medication. The second thing is I find that depending on the severity of the bipolar, that demographic tends to get looped into the medical system pretty firmly. And where the products that I offer tend to need a consciousness that's a little more nimble. I think you might this group is more nimble, in that way. And so I find it's a tough bridge to make between someone that's been very entrenched in not only a medical system, but then also the strategies provided there for bipolar. It's just, I haven't found yet a good bridge, a good bridge to have them into my world.
Dr. Steve, we reached the 8:50 and we have 2 questions. Are the questions brief? Can you be brief so we can wrap up?
I'll answer briefly. I'm Italian, but I'll try to be quick.
I'm half Italian myself. I understand.
You can just speak with your hands. That's okay. Yeah, just a quick one here. It's wonderful. Thank you so much. But and I was also wondering, many times that I've had people lead me as part of a group in kind of breathing directed. They will say, you breathe in for a certain period of time and then hold it, and then breathe out for a certain period of time and then hold it. Now, how does that differ? Is that less effective than what you're teaching us today?
No, my interpretation of that is in heart rate variability, there's like, in our heart rhythms, there's the uptick and the downtick. The vagal system is really, if you think of like when we watch that heart uptick and downtick, the down line is where the vagus nerve has been activated. That's at the bottom of the exhale. So holding the bottom of the exhale is kind of like pushing the brake in your nervous system to hold that down and to get the down cycle of the wave. The inhale is the uptick of the wave of the heart, and you hold it up there to kind of, you could reinforce and amplify that uptick of the wave. So it's not really a better or worse scenario. The one that I teach in terms of this setting is more about balancing out the autonomics of the parasympathetic and sympathetic. You don't really need much more than that if you're looking just to create balance in the autonomics. But if you're wanting to influence heart rate variability, which is definitely an important biomarker for our health, you can hold that uptick. You just know you're holding that sympathetic, you're holding that fight or flight, you're holding that uptick of your heart longer, and then you're exhaling, and then holding that exhale, and you're holding that heartbeat down in a way. You're holding that and teaching the system how to hold the brake on the vagus nerve and activate it. So just different strategies and different outcomes, not better or worse, just a different strategy. I might practice that like a Wim Hof breathing is the same thing. He measures heart rate variability. So he wants breath, big breath in, hold it, the Norwegian guy, hold it, and then exhale all the way out, hold it, and then back into breathing again for power. So he looks to activate the power of the nervous system, and then hold, and then release, doing the exact same thing you just mentioned. You're increasing the range of heart rate variability, which is important as we get older. So I would practice both, because generally our heart rate variability decreases in size as we get older. So to have a strategy or a practice that kind of forces that heart to explore its full range, to hold it, is wise as well.
Well, thank you so much, Dr. Steve. Really, it's a great talk, and I hope you can come back.
Yeah.
To listen to you.
Thank you so much, Dr. Steve.
Thank you.
That was fantastic.